we're human beings, right?
Yeah.
But people tend to forget that. Doctors, nurses, PAs, we are just as much human as anyone else. And it's naive and unfair to forget the fact that just like any other human being, we are vulnerable to the consequences of grief and loss and stresses and whatnot. Those consequences being mental health. We can develop that just like any other human being.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I am grateful to have with us today Dr. Michael Foti. He is an internal medicine physician who was a resident when that beautiful thing called COVID hit, which brings up a lot for many people, which he wrote about his experience in his book, Grief. It's a doctor's battle with anxiety and depression and so much more, where he goes over some very many impactful cases that he had and some other important things that happened in his own personal life during that time. But I will let him tell that story. Before we do, Michael, thank you so much for joining me.
Oh, thank you so much for having me and for reading my book. It's an honor, really. Thank you.
Yeah, and I mentioned you briefly. It was such a deeply impactful book, and I know in terms of reading other people's journeys and in writing, how healing it can be to just know that you weren't alone and to get those stories put on paper so we can talk about these things. And something I'm really grateful for you being such a mental health advocate in normalizing the discussions is like, that was not okay. We are often not okay. And I've heard you on other people's podcasts, and you were saying, I am a physician and I'm a human. And that's often very neglected to even normalize or to think it's okay to be human. So I appreciate you for that.
Thank you. Yeah. Yeah, it's ingrained in my story and who I am, and I know I'm not the only one who's or only physician or anyone really that suffered the way I did. And so, yeah, I'm just trying to empower others to get the help that I so desperately needed myself and obtained.
And for people who haven't had the opportunity to meet you yet and the privilege and honor, can you tell us a little bit more about you?
Yeah, yeah, definitely. So as you mentioned, internal medicine physician by training. I trained in Greenwich Hospital in Greenwich, Connecticut, one of the Yale University hospitals. Was in my intern year when COVID-19 arrived. Since graduating residency, I've kind of dabbled in different things, academic medicine as well as general internal medicine, primary care. But my love is in medical education, and that's what I'm doing currently. I'm full-time faculty at the Moro College of Osteopathic Medicine in Middletown, New York, uh, training the next generation of physicians, and it's a wonderful thing.
You are a true asset to many people who are now leaning into what it means to be a physician and to taking a deeper look at what it means to be a human in our healthcare system and navigating that. And for the people who haven't yet had the privilege of reading your book, can you tell us a little bit more about what to expect?
Yeah, yeah, and that kind of goes into my story. So if it's okay, I'll kind of share a bit about that.
Mhm.
Um, so as we kind of both mentioned, I was in my first year of training when COVID-19, that first wave arrived, and what my book highlights are some of the, and really only a few of the many patient experiences that shaped my time during that first wave of the COVID-19 pandemic. It was, these were 12, 16-hour days of really pure chaos. I was part of the RRT team, a rapid response team, so we were responding to emergencies in the hospital, and this was all day, every day. Because prior to COVID, I mean, we maybe were called to an RRT once or twice a day, and this was every hour that this was happening. I wasn't taking my N95 off. I mean, this was in one room, out into another room, out into another room, out, because every hour and a half hour, someone's oxygen levels were dropping. I mean, this was the norm, and it was it was difficult, not just because of the frequency of the emergencies, but the fact that most of these patients were near to my age. This is not this it was such an odd time because, before COVID arrived, what I had learned in my intern year, it almost a lot of the patient cases didn't really surprise you. It was rarely that you were surprised, right? Those zebra cases, we like to call them, right? I mean, this was rare that you were surprised. It's, you have the older person who, after the holidays, comes in with heart failure exacerbation, or an elderly person with aspiration pneumonia. I mean, these were things that you were saying, right? But now you're talking about people who, I'm in my early 30s, people in their early 30s who were coming in ARDS, right? And it's completely inflamed lungs and oxygen levels in the 70s and 80s, maxed out on anything you would give them. It was odd. It was like, this is not making any sense. And not only that, it was so hard to see. These were people who couldn't see their kids and their wives and husbands and their loved ones because they were stuck in the hospital with the disease. They didn't even know what it was, and none of us knew what it was. So it seemed almost like a battle zone. It was just constant, running around the hospital trying to stabilize every patient. But again, what made it most difficult were that these patients were so young and were dying with such frequency. And what kind of added to the fact that this was very much one of the darkest times of my life was around the same time my mom passed away to what we found to be undiagnosed stage 4 lung cancer. And she died within a few weeks of diagnosis, and it was pretty quick. She was 54 years old. So it was a very rough time for me, to say the least. And so I talk about a lot of these things and the experiences and how it happened in my book. And then I go into how my mental health journey began, how the symptoms of my panic disorder and depression manifested physically in very intimate detail. And then how I eventually got the courage to get the help that I needed. And and it's really ends on a message of how we can combat the stigma of mental health that you mentioned that exists in the medical community.
I am so sorry to hear of your mom. I know you shared it in the book as well. And I'm just so sorry for that loss.
Thank you.
And to expect you to not be impacted by not only that loss, I appreciate your title of the book, Grief. I think unprocessed grief impacts so many of us that we don't label. So even identifying
Yeah,
that as one factor
yeah.
and the trauma of what you were facing as a resident. And tell us more about the support or lack thereof that you were getting during your residency period.
During residency, we were as supported as we could be. I mean, the program tried to protect us as best as they could, but it was kind of all hands on deck. I mean, we were so short staffed that, and I think I talk about it a bit in the book. We had crisis staff coming in. These were people being given emergency privileges to come into the hospital to help us out. So even if now again this is something I think the system is working on, trying to provide resources directly for the health workforce in terms of mental health resources. Even if those were present in abundance, which they weren't, even if they were, I don't know that I even would have the time to utilize it
Mhm.
because this was every day, all day. I mean, we weren't stopping for months, until that first wave finally calmed down. We didn't stop, and you know, yeah, so it was I eventually um started talking to someone, but these employee assistance programs and whatnot, you do the best that you can, but um it's only so much. But yeah, I think it was just the times that it was in the moment. I mean, it
Mhm.
was because there was such little time, you couldn't process what was going on.
Yeah, I think that that shared factor of not being able to process from a time standpoint, sometimes from a resource standpoint, sometimes from a stigma, which you are working hard to crush standpoint, and in concern about impact on medical licensure, which is also tides are turning, but slowly. I feel that that unprocessed, all those emotions that come up really set people up for development of what you noted as panic disorder, for PTSD, for moral injury, and I don't know if people are taking a step back to consider that the reactions that they might be having are symptoms of some of the things that develop from not being able to process in a timely manner. What are your thoughts on that?
Yeah, I mean, I think that's definitely part of it. It is very much kind of like a PTSD because you're not processing in the moment, and it's coming. I mean, it came back to me 3 years later, and that's because I didn't process the grief of really, the loss of so many patients and of my mother. I will say that again was a product of the time in terms of the COVID, that first wave of COVID. Is really tough to even again utilize resources if you want to do. However, I will say we are in a severe shortage of resources for our health workforce, meaning specifically for our health workforce, because as you know, most of these healthcare facilities and medical education institutions, you know, it's the bare minimum. They don't have dedicated uh, staff, like a behavioral health center,
Mhm.
that are dedicated to the staff and the physicians and the health workforce, right? Meaning that they're not treating the patients also, they're only treating, for the being there for the staff and the health workforce. So, you know, for conflict of interest purposes. Uh, and I think the other part of this is that I think a lot of the health workforce are not getting the help that they need because we're not campaigning enough on mental health within the institutions themselves.
Mhm.
Right. Plenty of us are campaigning about it on our own, and we're waving our flags and doing everything we can to say, like, we need to be talking about this. We're trying to shed light on it. But how many hospitals, how many medical offices are campaigning on this, right? Actually putting that out there. I think that's the question.
And some medical systems will support through lip service that they recommend you get mental health support or that they are a neutral party or that they are advocating for it. And then some will genuinely say, we want you to do that. Or some will understand that it's important to help physicians if their bottom line is wellness of the institution financially and for the patient safety. It's in their own best interest to advocate for physicians, but I don't know if that's coming from like a place of me feeling still the anger of me being let go and the pain that that caused, or if it's reality that some people are in situations where sure the institution sounds on paper like it's advocating, but then is it really?
Yeah. I mean, that's the thing. Because a lot of these institutions, I don't know. If it's fair to say campaign in silence on this, because they have these, resources like employee assistance programs and whatnot, and say so that they can say, yeah, yeah, we have the resources if you need it. But that doesn't empower people, right? That doesn't empower you to say, I need to stop
Mhm.
and take care of myself, right? That says, do what you need to do, but either work or you're not working, right? You talked about like sacrificing yourself for your patients. That's what we're expected of us, to sacrifice ourselves for our patients. I I think that that terminology is an unfortunate byproduct of the culture of medicine that for decades has kind of been perpetuated. Yes, we are putting ourselves there for our patients and putting ourselves on the line. But if we're doing so much so that we're killing ourselves, literally,
Mhm.
right? Physician suicide is such on the rise. Well, is one death more significant than the other, right?
Yeah.
Then that so I say at what cost,
Yeah.
right? I'm not saying that we shouldn't sacrifice our time rather, and put all and everything and every inch of ourselves for our patients because patient care is so important, of course. But it should not be at the sacrifice of our own well-being. Because then if we're dying, well then who's treating us? Right? I mean, at the end of the day, I mean, it's not eye for an eye, right? It's not a person for a person here. I mean, that's the thing we need to start thinking about. And when I talk about my book, we're human beings, right?
Yeah.
But people tend to forget that. Doctors, nurses, PAs, we are just as much human as anyone else. And it's naive and unfair to forget the fact that just like any other human being, we are vulnerable to the consequences of grief and loss and stresses and whatnot. Those consequences being mental health. We can develop that just like any other human being, right? We need to normalize that this is part of the human experience, no matter what profession you're in,
Mhm.
and really truly campaign on mental health at all systems in the healthcare field, where we're coming out and saying, we care about our doctors, we care about our nurses, we care about our Ps, all the health workforce, we care about you, and we have these services for you. Your health is our health. There is no health without mental health. That should be emblazoned across every healthcare facility in the country and really in the world.
Yeah, so what I'm hearing you say is that it's an overt top value, top core mission for institutions and healthcare facilities at large to say, we care about you first, humans first. In order to serve the patients, we have to serve those who take care of the patients.
Right? Right?
And yes, and what you said was, and here are the resources, right? Not only saying it, but showing us. So if I was showing you that what I said was true, what would that look like in your mind?
An actual dedicated behavioral health center for the health workforce at all institutions on top of the campaign. The campaign, I agree, is only part of it. The campaigning tells the health workforce that we care about your well being, empowers them to say, if they're in that state, I need help and I can get help here. And now there's actual resources for that. There's a center where they can
Mm.
go and see, a licensed social worker or a psychologist or psychiatrist.
Yeah, and as
Yeah,
you're painting that picture, I was considering what you mentioned before and being a very important aspect of that when you said, and even if those resources were available during COVID time, I wouldn't have had the time. So what would that look like in terms of creating time? So I work with physicians during coaching, and a lot of times they say, we have all these resources at our institution, but I don't have any admin time. So if those resources are available during working hours, I kind of feel like that's salting the wound, right? Or hanging that carrot really close to the rabbit, but not yet letting them consume it.
that's right. I mean, that speaks to, you can't provide the resources if you don't provide the time for them to get the help that they need, right? I mean, that's another
Mhm.
part of it. I mean, like, for example, we changed the resident hours, right? And yet I still hear, again, this is why, and I don't know if you hear this too, this is why the culture still needs to change. I still hear from those who trained well before I did, almost as this is a negative thing. Oh, we changed the work hours. I wish I had that. Oh, it must be nice. Well, and then I have other people who are not physicians saying, "Oh, well, does that mean that they're well prepared then? If they're not getting the same hours that you guys did because you were working so many hours, are we sure now?" Blah blah blah. Like this is the conversation.
Yeah.
We're still questioning why we made such a systemic change to resident work hours. Where we're going to start looking at residents as weaker now. I'll tell you, I went through it. So now
Mm,
it wasn't easy. So
yeah.
we made it. We changed it from impossible to nearly impossible. Doesn't mean anything. You know what I mean? That doesn't make a better physician, right?
Mhm.
So yes, it, the amount of hours you could work does not make you a better physician. You have to be
Yeah.
compassionate, caring, and have the
Mhm.
medical knowledge and the medical reasoning and the skills. That's it, right? That's what you need.
Mhm.
Now I know others will argue, well, you need to put a certain amount of hours to develop those. That's fine. It doesn't need to be in a row.
No,
You
or in
still
residency, right? It's
yes.
medical school is a foundation, residency is a foundation. We are
Right.
lifelong learners.
Yes, 100%,
And
100%.
if we're sleep deprived, we're actually going to retain less, right?
Yes. This
And
is scientific fact.
yeah, and potentially lose our lives. So I lost my co-resident, passed away. My co-resident passed away, my ex-boyfriend passed away, and my commander passed away all when I was nearly dying from anorexia during residency. So I offer that because at that time I thought I had to be superhuman to prove my worth. And I felt shame that when I was sleep deprived, I felt suicidality. No matter how much thought work I did when I was sleep deprived, we didn't have post call. So we would take call and then be in clinic, and it was just this chronic sleep deprivation. And I was having questions whether or not surgery was right for me. So I didn't have that intrinsic like drive, like, oh, this is a short term circumstance in order to get this goal. I was actually highly doubting that that was the right professional choice for me. And I kinda knew inside, like, I wasn't eating, I wasn't sleeping, I was running all the time, I was high stress. I was like, "Before I take any medications, can we address these factors that I believe are contributing?" And when I went to what I believed was the highest level of support at the time and didn't feel I got what I needed, it actually made me feel worse inside because I didn't know what other answers there were. And what I really love about you sharing your story is that it took one person sharing their story and validating that I wasn't alone to save my life, to have me step back and be like, okay, like I am not the only one experiencing this. And to hear what I was experiencing coming out of somebody else's mouth was I could take a breath of fresh air and at least step out of my brain for a moment to say, okay, what's really going on here?
Yeah, and that's I'm so first and foremost, I'm sorry you went through all, and that's I'm so happy that you heard that voice and that helped because that's exactly why I'm sharing my story
Mhm.
because I'm not the only one uh, who has or is currently suffering in silence. So this is why I'm sharing it because I'm trying to empower others to say, hey, someone else is going through this, and I can get the help that I need.
And you
Mhm.
said you before you were saying, "I finally had the courage." So what did it take for you to say, I'm getting help?"
My family, yeah, and I talk about it in the book, but it was very tough on me to know how much I was depriving them of, and not just money and all these other things because I was on medical leave, but I was depriving them of me. I was depriving them of a husband and a father, and it killed me.
Mm,
And so eventually, I said, if I'm not going to get this help for myself, I got to do it for them because it's not fair to them. And it was the best thing I ever did in my life. Yeah.
what do you find about, certain modalities, maybe if people haven't yet explored modalities that can be helpful for them? Can you give some options that you found would be really supportive of your journey?
Yeah. So I saw a psychologist and underwent cognitive behavioral therapy, and it was phenomenal. It gave me the tools really to, for the sake of my panic disorder, it gave me the tools to, if I felt it coming on, really, it wasn't like just, oh, rationalize the fear or whatnot. You know what I mean? It was more than that. It was so much more than that. It was like, it was to survive the emotion and realize that this is something I will get through. And it also showed me that a lot of my fear was of the unknown. It was
Mm,
my mind was sitting in that unknown, but not actually saying, "All right, but what are you actually afraid of happening?" Like, to the detail.
mm,
That's what my psychologist worked with me to say, "Let's walk through this," because I was never actually walking through it. It was just there, right? So it
mm,
was like, "Let's walk through one of these fears you have and go from beginning to end." And it was like actually it was like instead of being afraid to open the book and read the first chapter, she was like, "No, we're gonna go through this thing."
mm.
And it was unbelievable. It, like, smacked my fear in the face. It was like
Wow.
where I've gotten to a point now that I can it's interesting. I tell people it's almost like an outer body experience where I see where my mind would have went
Mm.
years ago, and now it's like, wow, now I know I'm starting to recover because I can see where I would have went with that, and now I'm good.
Wow. Amazing.
Yeah, yeah, yeah. So
Wow.
I highly recommend. I mean, it was phenomenal for that, and for my depression, a lot of the healing there came through processing the grief. I think that was finally coming to terms with that, all the loss that I experienced, being okay with it, in that, kind of there was a lot of guilt around it, a lot of guilt around the loss of my patients, a lot of guilt around the loss of my mother, and trying to remove that guilt. And by not remove that guilt, but understand that I shouldn't have that guilt, really. I did my best for my patients, I did my best for my mom, and just processing those emotions and being there with my family, and that really helped me through my depression.
Well, thank you.
Yeah,
And now you're
yeah,
on a mission. Tell
yeah.
us more about your mission.
Yeah, so, you know, it really started, in the fall. I'm a full-time faculty member, as I mentioned, and, I learned at the institution where I'm working that the students have a wellness committee. And so I thought, well, I haven't ever shared my story. Maybe I should do so. I think it would be maybe therapeutic, not just for me, but for my students. I didn't know. I didn't know how I was going to be met. I was like, it was really a long shot because I really had no idea. So, and the students, I knew them for a couple months. I had started there in July, but it wasn't that they were just going to be nice to me because they knew me for so long.
Mhm.
So, so anyway, I went and it was like 20, 30 students, and I shared my story, and it was met with such positive feedback. The students figuratively and literally embraced me after the talk.
Aw.
They all came up to me after, and we took a big picture and everything, and it was really nice, and it led to a snowball effect. Our other campuses were reaching out to me because they heard about the talk and they wanted me to speak to them, and then turned into platform after platform, podcasts, talking to organizations, things like that. It just kept coming, and uh, one of the highlights being that I was invited by the National Academy of Medicine to speak
Wow.
alongside our U.S. Surgeon General at the inaugural Health Workforce Wellbeing Day, and that was a big honor. Um, and yeah, so and then within all of that, uh, last summer, I started writing down my experiences because again, starting as something therapeutic. And as these talks and speaking engagements kept continuing, I said, well, I definitely could even reach more people, I think, with a book. Right. And so it turned into this,
Yeah.
which,
I'll share mine
I'm
too.
very proud. Yeah. Very, very proud uh, that it became a book. And
Mhm.
yeah, so my mission is very much, you know, uh, um, a good friend of mine who I was on his YouTube channels as well, Chris Stowers of Mind Split Cafe. He said to me the other day a quote that he had heard: "Recover out loud, so others don't suffer in silence."
Oh, I love that. Can you repeat it?
So it's recover out loud, so others do not suffer in silence.
Oh my gosh. I might have to use that for the title of your video because it is an incredibly impactful quote. Is it his quote or is it a famous quote?
That I don't know. He shared it with me. It might be his, or maybe he heard it from someone. I'm not sure. But we
Yeah.
were talking, and yeah, yeah,
We'll see who
yeah,
if we need to credit some other people for its use, but that is a very impactful quote. Thank you for sharing it.
yeah, yeah. It was so interesting that he shared it with me because it embodied everything I've been doing.
Yeah.
For the last, 8 to 10 months, which is, I am still recovering. I mean, I'm still grieving my mom, every day. But in a way, I'm happy to because I wasn't grieving at all, which is what landed me into everything that I was dealing with.
Yeah.
All the manifestations of my mental health journey
Yeah.
was because I hadn't processed anything. Now I'm processing it.
Mm.
So I'm happy to recover out loud because I don't want anyone to suffer in silence the way that I did.
I just got the chills because I suffered in silence for 5 years and it nearly cost me my life again. And I know so many people are suffering in silence, and I think many of the people who do take their lives just because they are suffering in silence and we don't have the signs. But just that 5 years I spent, I was so isolated, it was guilt, shame, and this deep pain of unworthiness after I was medically discharged, and I know other people are feeling it, and that the impact you will have will not only save people from potentially taking their own life, but sparing them that pain of continued grief and isolation alone without just reaching out to say, you know what, I think I'm going through now, like you said, you have a name for it. Even just investigating, I think sometimes people think that they're experiencing burnout. And when they rest and don't recover, they're like, I wonder why I'm not recovering. Well, what they maybe not have faced was that there's this layer of moral injury. There's manifestations of PTSD, and there are other things that are happening that warrant different therapeutic modalities and the trauma we store in our body, like your panic disorder, like the somatic symptoms that arise, and having someone to guide us through it. I was reading a lot about pacing because those symptoms can be so overwhelming. Like the panic thing just go from 0 to a bazillion, right? Mile per hour. And to have a guide with you to help you to take things incrementally so you're not flooding yourself, but you're able to process through and really feel supported on the healing journey.
Thank you for sharing that. Yeah. No, I know what it feels like to suffer in silence too, and, um, I have my family to pull me out of it. Not everyone has someone. So I, along with I'm sure many others, are trying to be that someone for other people. Try to grab them out of it and try and save them as best as we can.
Yeah, so anyone with a platform, with a place where Michael can speak and share his story and help other people to hear it, help them to know they're not alone, where can they reach out to you to connect with you for that?
Yeah, LinkedIn, Michael Foti DO. I'm happy to connect. And I really would really appreciate it.
And of course, we need to share your deeply impactful book. This is on Amazon, or where else can they find it?
Yes, Amazon and Barnes and Noble.
Amazon and Barnes and Noble. And what would you like people to take away from this discussion?
I think uh, just the one thing I always tell people is just take care of yourself.
What does taking care of yourself look like today?
Getting the help, whatever help that is for you. I think it's you know, not ignoring the signs. I think, and also never feeling, and I think I talk about this a little in my book, but never feeling that what you're going through is a weakness and that you should be afraid. Don't have fear to speak up and get that help because it's not a weakness at all. It should never have been considered that, and never should be considered that. Anything that you're feeling, and in fact, the strongest thing you could do is get the help that you need, and you will be in such a better place once you do get that help. I can attest to that.
Well, thank you, Michael. I really appreciate you sharing your story, your wisdom, and also the support for all who are tuning in today.
Thank you, Jillian. Thank you so much for having me.
Yeah. And for the audience, if you want to commit and set intentions for how you are going to take care of yourself, we love to hear from you. Have a way that you can have a community to support you. Please share those in the comments below. I will also share the link to Michael's LinkedIn and his book in the description. And we appreciate you being here. Until next time.